Hello everyone, my name is Irina Bonder and I am a medical oncologist. Today we will talk about the most common benign diseases of the breast. By the end of this video, you will know which benign breast diseases do not pose a threat to your health and when you need to start treatment as soon as possible to prevent transformation of the benign tumor to malignant one. So, let's start. The breast is a dynamic structure in which cyclic processes of proliferation and involution occur throughout entire life. These changes can be so pronounced that they go beyond the concept of normal. Many specialists classify hormonal disorders of the breast as aberration of the normal development and involution. This doesn't mean that these diseases do not exist, but rather that the most pronounced forms of such deviations are classified as diseases. One of these diseases is mastopathy. Mastopathy is a benign condition of the breast that occurs in response to hormonal disorders in the body. The main causes of mastopathy are increased level of estrogen hormone, decreased level of progesterone hormone, and excess prolactin hormone. There is disruption in the rhythm of hormone secretion and their ratios. Some hormones have a prolonged effect, while others have insufficient action. This leads to changes in the normal cyclic processes in the breast. Various pathological conditions can alter hormone levels, which have an insufficiency of the breasts. Increased estrogen level causes hyperplasia of the ductal part of the breast, leading to the development of cystic changes. Moreover, estrogen hormone causes an increase in intracellular osmotic pressure, resulting in fluid accumulations in the tissues. This accounts for premenstrual pain syndrome and breast pain before periods. It is difficult to determine which combination of hormonal factors plays a major role in the development of breast diseases. Medical treatment often does not give possible results. Achieving recovery through the surgical treatment is not possible because the endogenous factors that cause these disorders will cause a recurrence of disease. There are numerous benign diseases of the breast. Let's discuss the most common ones. First, cysts. Diagnosis can be easily made by ultrasound examination. Cysts are fluid-filled cavities that usually do not require surgical treatment. Cyst aspiration is performed for diagnostic and therapeutic purposes. Anti-inflammatory therapy is prescribed if inflammatory cells are detected after aspiration. If the cyst recurs after 3 aspirations, or if papillomas or atypical cells are identified, surgical treatment is recommended. Usually it happens rarer. Conservative treatment of hormonal disorders that cause the formations of cysts is performed. Then fibroadenoma. This is the most common breast tumor. It is the more common seen in young women and originates from the lobes of the breasts. Fibroadenoma is considered more as a disturbance in the development of the breast lobes rather than a true tumor. It is present as a solid, well-defined, movable mass with slow growth. It is often increased in size during pregnancy. Conservative treatment and observation are possible for small-sized tumor up to 2 cm. Surgical treatment is recommended if the tumor continues to grow or if conservative treatment is ineffective. The surgery can be scheduled during the next vacation period without any urgency. Phylloids or leaf-like tumor. This tumor borders between benign and malignant tumors. It is characterized by large size, rapid growth. The size of this tumor can reach up to basketball. Core needle biopsy are performed to confirm the diagnosis. This diagnostic method involves puncturing the tumor with a large diameter needle to obtain a tissue sample. Nodular fibroadenomatosis. It is an excessive growth of connective and glandular tissue in the breasts, resulting in the formation of solid focal or diffuse benign formations. Nodular adenomatosis is the most common reason for surgical intervention on the mammary gland. Breast consolidation that are recommended to be removed for diagnostic purposes, to exclude or not to miss a possible malignant tumor. And last but not least, intraductal papilloma, also known as Means disease. This is a benign formation that occurs on the epithelium lining the ducts of the mammary gland. The main symptom of this disease is nipple discharge, sometimes with blood. Due to the high risk of transformation into malignant process, the only treatment can be performed is only surgical. Dear ladies, you should understand that breast problems are not limited to the breast itself. Rather, it is a manifestation of hormonal dysfunctions in the other organs, and the treatment should be aimed at normalizing the hormonal balance of the entire body. Very often, mammologists can recommend women with hormonal problems in the mammary glands to undergo additional consultations with gynecologists and endocrinologists to exclude pathology in these organs and also for possible treatment if necessary. It is important to remember that all endocrine organs are closely interconnected. This especially applies to such organs as the thyroid gland, mammary gland, and gynecological sphere, namely ovaries. Hormonal regulation disorders in one of these organs inevitably leads to changes in another organ. I have many examples among my friends or my patients who constantly treated breast problems. They underwent surgical treatment several times, and afterwards the tumor recurred. It lasted until these women normalized their hormonal function of thyroid gland or ovaries. I hope this information was useful to you. Leave your comments or share your experience under this video. Subscribe to my channel if you want to know more useful information. Take care and see you next video.